Good day everyone, I am Naisimulan Silungan from Bsn-2B, student nurse of Notre Dame Tacorong College of Nursing. So today, I will demonstrate how to perform the bug technique. So the definition of that is, it is a tool making use of a public health bug through which the nurse during his or her home visit can perform nursing procedure with ease, less time and effort, and renders effective nursing care. And the purpose is, of that is to render effective nursing care to clients and or members of the family during home visit. And the content of the bag in this arrangement, and the front of bag, the left to right is the oral thermometer and rectal thermometer, and on the right near end of bag is the test tube and holder medicine dropper. On left near end of bag is medicine glass, weighing scale, bandage scissors, and the back of the bag left and right is alcohol 70% solution and the acetic acid, aromatic spirit of ammonia, benedict solution, and the betadine. And the include of the bag is the center of bag is corset or straight and curved, roller bandage, alcohol lamp with denatured alcohol, and the kidney basin. And on the top of center of the bag is hand towel, soap and soft dish, and paper water bag in pocket bag. And the ophthalmic ointment is hydrogen peroxide, separate solution, spirit of ammonia, acetic solution, syringe and needles, and container 2 ml, tape measure, cotton applicator, cord lamp, rubber gloves, newspaper to save cleaning, apron, and the last is plastic lining. And the note of that is blood pressure apparatus and stethoscope are carried separately. The package containing a sterile drape, sterile equipment as needed, grab, sterile gauze, and antiseptic solution. And the first procedure is upon arriving at client's home, place the bag on the table or any flat surface line, or with paper lining, clean side out or fold part touching the table, and put the bag's handle and strap beneath the bag. And the rationale of that is to prevent spread of microorganisms. And the next is ask for a basin of water and glass of water if faucet is not available. Place this outside the working area, and the rationale of that is to prepare for hand washing. Excuse me po ma'am, pwede po ako makalimit po ng tubig pangulas ko lang po ng hand. And the next is open the bag. Take the linen or plastic lining and spread over your work field or area. The clean side out or folded part out. And the rationale is to prevent spread of microorganisms. And the next is take out hand towel, soft dish, and apron, and place them in one corner of the work area within the confines linen, plastic lining, and the rationale is to prevent spread of microorganisms. And the next is do hand washing, wipe dry with towel, leave the plastic wrappers of the towel in soap dish in the bag. Rationale, to prevent spread of microorganisms. And the next is put on apron side right out and wrong side with crease touching the body, sliding it to back neck strap, and neatly tie the straps at the back. Rationale, to prevent spread of microorganisms. The next is put out things most needed for the specific list and place at one corner of the work area. And the rationale is to prepare for the next action. And the next is place a waste paper bag outside of work area, and the rationale is to prevent spread of microorganism. And the next is close the bag, and the rationale is to prevent spread of microorganism. And the next is proceed into the specific nursing care or treatment. And the next is urine test for albumin. The first procedure is cleans and assembles all articles, equipment needed. And the next is prepare 3 or more cotton balls with denatured alcohol or alcohol dump, and fill the test tube 2 to 3 of urine. And note, urine specimen should have been collected early in the morning before breakfast. And the next is heat the upper portion only of the test tube with urine without shaking. Compares the heated to the unheated portion for changes. And the next is read and interpret result correctly. And if there is no changes on the heated portion, the result is negative. Acetic acid is not added. If cloudiness appears, add 5 drops of acetic acid to the urine. And the next is heats again to rule out presence of phosphates. Note, if cloudiness disappears, result will still negative. But if persists in spite of addition of acetic acid or even depends, the result is positive. And the next is discard things appropriately and explain correctly and comprehensively to the client and caregiver the result and interpretation of the test. And the next is urine test for sugar. And the first is measure 5 ml Benedict solution in the medicine glass, and the next is holding the test tube with the holder and heat it over the spirit lamp till the Benedict solution boils without overflowing. And the next is drop 8 to 10 drops of urine into the boiling Benedict solution. After again boiling the mixture, let it cool down. And while cooling, the mixture changes color. And the color of the mixture serves as a guide to the amount of sugars in the urine. And read the interprets the result. And for the blue color, sugar is absent, and the green color is 0.5% sugar, and the yellow color is 1% sugar, and the orange color is 1.5% color sugar, and the bright red color is 2% sugar. And the next is the discard things used appropriately and explain correctly and comprehensively to the client or caregiver the result and interpretation of the test. And the next is, after completing nursing care or treatment, clean and alcoholize the things used. And the next is, do hand washing again. And the next is, open the bag and put back all articles in their proper places. Remove apron, putting away from the body, with sorted side folded inwards, and side out place it in the bag. And the next is, fold the linen or plastic lining clean, place in the bag, and close the bag. And the next is, make a post-visit conference on matters relevant to healthcare and taking anecdotal preparatory to the final reporting. And the next is, make appointment for the next visit or either home or clinic, taking note of the purpose. And the next is to eat that the waste receptacle and its content are properly disposed of before leaving the home. And the next is, maintains body mechanics throughout the procedure and manifest neatness on the performed procedure, and provide and ensure patient privacy throughout the procedure. And the next is, observes courtesy and shows calmness while performing the procedure, and detects mastery of the procedure. And the last is, uses correct grammar and syntacx. And that's all for the BAB technique. Thank you for watching.